Welcome to the Medical Device Made Easy podcast. Here is Monir El Azzouzi from easymedicaldevice.com, and today we will talk about a certain process that you have to follow under ISO 13485 or even under QSR, which is the management review. So I wanted today to just have a kind of an explanation of this process, because I had a lot of my customers that are contacting me and saying, okay, what should I do for this? What should I provide? What are exactly the process to do? So the idea of today is to explain to you what is a management review, why this is so important, what should be in terms of documentation available for review. I hope this will be really helping you, because this is a key process when you are trying to get ISO 13485 certified. So I wanted to start first by explaining to you that the management review is mainly mentioned in the ISO 13485, and you have to have a procedure that is existing where it's telling exactly how you will execute this management review. And this management review is like a meeting. So if you have never been participating to a management review, it's a meeting that is under the responsibility of the top management, and where the top management has to evaluate, review, check your quality management system. They have to verify that this is working well, or if there is any changes to do, etc. So I will go through all the inputs and outputs of your of your management review. But first you have, as I've said, to create this procedure. The procedure should tell you exactly how you are executing this management review, and it should, not mandatory, but it's better to have that, specify also some formulas or templates or forms that will be used during this exercise of management review, because it's not an exercise that you are doing only once. You have to do that periodically. The period can be once every year, or twice per year, or once every quarter. You can define this periodicity, but you have to justify also why. Why once a year? Why once a year is sufficient? So mainly this is the idea of saying, yes, once a year is sufficient because maybe you don't have enough data, or it's within 1 year that you'll really gather a lot of information to do this evaluation. Because if you do that every quarter, but you don't have too much data to review, it will be a waste of time. So when you get those forms available, then you have to use them, and those forms are really to gather the information that you are executing the management review per procedure, per what you are writing on the procedure. So it's why those forms are really interesting, because then you can, if I can say, always follow the same process to do the management review, which is something that is really important when you have a quality management system. To not once gather this information, another time another information, or another way to present, which can be confusing for everyone. So you have this management review that will be planned then once a year or twice a year, etc. And you have also to have people participating to this management review. So for people that are participating to this management review, they have also to be trained. It means that you have to have a proof that they have been trained to the procedure, to the formula, the forms, templates, etc., so that they are really understand what is the objective of this management review, why they are doing that, and which information they should provide to it. So it's important to have this information this training done and available, so that when people will be executing and be participating to this management review, they have a proof that they have been trained to that. So this is something that you should not miss also. One thing also that is important is to define the quorum. So what is the minimum number of people that should attend this management review? As we said, it's the top management. This objective of the management review is mainly for the top management. It's not just for anybody, it's just for the top management to review and assess that everything is fine within the quality management system. So if the top management is not present during this meeting, then you cannot do this management review. If maybe one top management is available, maybe it's not sufficient. So you have to define a quorum, which is kind of like how many people and what kind of people are we looking for. For example, at a minimum, there should be the CEO, the COO, and the quality vice president, or this kind of thing. And you can mention those kind of names, or you can say 3 management with executive responsibilities, etc., that should be available. So if those 3 management with executive responsibilities are not available, then you cannot perform the management review. And this is something that is important to have so that when you are signing the attendance list, those names are there and those people are also trained, as I've told you before. So everything then is working. So mentioning on the procedure, the minimum number of people is really important so that you have to cancel the meeting and you have a justification why you cancel the meeting if you cannot do it because the people are not available also. What you have also to understand is that a management review is not just a meeting that you are just having once and say, oh, let's have the meeting tomorrow and let's review our quality management system. No, you have to prepare this meeting. So it can be maybe 1 or 2 months of preparation sometime where you gather all the data, and we'll look at after the inputs, the data that you should gather. And then you'll gather all those data, you will analyze those data, and you will show that to the top management to tell them, here is the situation for this and that, and here is what we can say about it. And then there should be a discussion. It's not just a presentation like I tell you and you listen and then you sign the document and you leave. No, it's a discussion, meaning here are the data. Do you have some questions? Do you maybe something that is not correct here, etc.? And then you should make it like a living meeting. It's not like just a presentation, somebody showing and you just saying yes, yes, yes. So it's why the preparation is also something key. So you have to have your team that is preparing the data, and there will be some quality information, so there will be some production information, there will be some regulatory information. So there will be information coming from different places. So you have to make each of your team members involved on the preparation of these slides. Usually what we are doing is that we have this presentation, and each time we speak about a topic, the responsible of this topic is coming and explaining and answering questions of the top management related to that. So this is mainly what we are also expecting from you. So when you are starting your management review, first, you have to send an agenda to people. So this is first document number 1, an agenda which shows exactly what you will be looking at, what is the period we are covering, who should be there, etc. So an agenda. Then you are preparing this presentation. I said usually what we are using is like a PowerPoint, like a slide deck presentation, and we are providing information about this first topic, the second topic, the third topic, and each time, as I've said, people are coming and talking about that. So we have a slide deck, a presentation. Then we have a report. The report should be providing information about maybe discussion that there have been, also about actions to perform. So you say, oh, on this slide I didn't like this way, can you gather more information on this or on that, or can you show me this and that? So then you can have an action that is an outcome of this meeting also that you have to then execute. And the last one is the attendance list. So mainly you are placing here a list of who attended and signature and date for those people, that you can prove that those people were there. As I've said, that there is a quorum, so a certain minimum number of people that should be available. So if you have those 4 documents, then you are good, if I can say, to go for this management review. So what are the inputs now? Mainly, as I've said, you have to gather a lot of information, analyze them, and then get some outputs out of it. So the first input, and it was not the first on the list in the ISO, is the follow-up actions from the previous management reviews. So if it's the first management review, there is no follow-up action because it's the first one. But if you had multiple management reviews, there was some follow-up actions that should be provided, as I've said on the report. So my advice is that place the result of the follow-up actions as a first slide or first topic to discuss prior to start all the other topics that will follow. Because you have to understand what happened last time. It's like looking at a series or a show, and they tell you, oh, previously here is what happened, etc. So here it's the same. Previously, what happened previously? What were the action? Have we closed all those actions where there's still something that is open, etc. So you have to have those information so that also people understand what's going on there. Then another the first input that is mentioned on the ISO, which is a feedback or complaint handling. So mainly you are receiving some feedbacks about your products, for example, during a conference, or because you met somebody on a plane that says, oh, it would have been great if you put your device like this or like that, etc. So you can get some feedback, and you can get also some complaints. So it's not like you are evaluating each feedback or each complaint during the management review. You are gathering all those data, and you say, oh, for example, on the month of January, we received 10 feedbacks, and all those feedbacks were about this topic here. Do you think we need to improve that thing? And then this is a discussion starting. Or in terms of complaints, we received 7 complaints during the first quarter of the year about this issue, but we were able to solve that. So now the issue is over, and during the next quarter, we should not see that anymore, etc. So this is the kind of discussion that you have. So you are not looking at each complaint one by one, because normally this is done during the complaint management system. But maybe there is one complaint that you have no clue how to solve that, and then you can bring that to the management review and explain, oh, we have also this complaint. We want your advice because there is something that is maybe not correct, etc. So you can also have this discussion there and tell that you want to have a better investigation or more time for the investigation due to that, etc. And you have a good justification for it. So this is, for example, the first thing that you can discuss during the management review. The second thing is reporting to regulatory authorities. So for example, when you are an issue on the market and you have some adverse event, you have some vigilance reporting, then you are telling, oh, we have reported this issue, etc. Normally, the management is already aware about that because they are signing the reporting. But here it's to gather how many reporting we had. Usually, there is not too much reporting. I mean, once a year maybe is a good thing. But if you have multiple per year, it's like you have maybe a big organization with a lot of a big portfolio, and then you can have some multiple vigilance reporting. So here you have to mention how much vigilance reporting there was, what was the consequence of it, etc. So you are also providing some information about what have you done to improve that, or what have you done to improve the system. The next one is audits. So when we talk about audits, there is internal audits. So normally you are showing the schedule for internal audits. When will it happen? Or if it happened already, what was the result of it? What was the result of the internal audit where you have maybe received 3 observations, etc. You can talk also about external audits. So from the notified bodies or certification bodies that are coming, and you show the agenda, it will come during that month, or you say, oh, it's already happened, and then here is the result of it. So you can also show that. Third one is also supplier audit. So when we are using some vendors, you are also managing those vendors or suppliers, and then you can maybe also have to audit them. So you can also define a schedule for which supplier will be audited during the next quarters. And for those that were audited, was there any issue or any problem that happened also? So this, you see, it's to gather a lot of information and then to make an analysis and a summary of it for the management. Then we have also some monitoring of and measurement of processes, where you are, for example, measuring the process of cleaning, where you are measuring the process of the clean room, verifying if the temperature pressure is always good, if there was no alarm, or the bioburden, or the cleaning water, the water of samples that is provided to laboratories every month, and you are checking the result. So here is the monitoring of your processes, the process that you are using for manufacturing maybe your product, the stabilization process. Maybe there is a regular also validation that is done for the processes. So you are providing those data to show that yes, all our processes are doing well, or there is one process that is in the alert limit, not the action limit, but alert limit, and here is what we'll try to do to open that or to make that happen. We have also product monitoring, where you are checking if there was some non-conformances for your product, some scrap rate, etc. So you are trying to analyze if there are some issues about your product, or about maybe the product that is in design actually, and you are trying to make some first lot and you find a lot of issues. So you can also discuss about all those things. Then we have corrective actions and preventive actions. Here you are looking at how many CAPAs you have opened, if they were open long time ago, like we can call that aging. So for example, we say, oh, our CAPA should not be open more than 1 year. So if it's open more than 1 year, why? And they have then to put maybe extra effort to close that as soon as possible. So you are discussing all those CAPAs. So once, if I can say, within one of the management review, we had a discussion about kappas, but it was a strange one because at the end we didn't had any kappa that year or that month or that quarter, I can't remember. And we had opened a kappa because of that, because we say it's strange. For the last 3 years, we had near minimum 2 to 3 kappas every quarter, and now we have nothing. Is there an issue? So the point is here is like, are our inputs, our system to collect those information, is it broken or not? Is there any issue or not? So we had to look back at all the different systems that are gathering, that are triggering the opening of a kappa, and to see if everything is fine. So the kappa was open because there was no kappa. So you see here how far we can go on this kind of thing. Then we have also, and this is an important one, all the changes that could affect the quality management system. So if you have, for example, an organizational change of your manager, change of some people that are on the quality department that are really important, this is something that you have to mention here. If you have a change of a process, a major change of a process, you say, oh, before we were, for example, using paper for quality management system, now we go for an EQMS, electronic quality management system. Then it's a major change and you are plating that here. And you are not just saying, oh, we are changing. We are saying that it's going through a project, that the risk was evaluated and there is no collateral damages. We have some kind of effectiveness monitoring ongoing actually to check that there is no issues out of that, etc., etc. So it's not just informing, it's also reassuring and saying, we have done that, but we have done that in a certain manner that there is no issue that can happen for our quality management system. Then you can have also a section to recommend some improvement. As I said, even all along this list that we have provided you can define maybe some improvement to improve the system, process, product, etc. So you can also gather those information here and just check that everything is working correctly. And the last one that is on the list is mainly all the new or revised regulatory requirements. So for example, we moved from MDD to MDR. This has maybe some impacts on your products, on your company. Then you have to mention that. What have you done maybe to review that? I am, for example, providing every month a monthly review of the regulatory updates. So this is something, for example, that can be an input to your management review to say, we have this, that changed in the regulatory field. So this has no impact on us, but this one has some impact, so we have to make further analyze. Or this one has some impact and we have made an analyze and we have consequently changed this or that or that. So you see here, you are gathering the information and you are explaining what you have done to confirm that the information is impacting or not, and what you have done if it is impacting, what have you changed, etc., etc. So this is all the regulatory updates that you have to provide. And what is good is if you can do that even in advance, you know that in 3 years something will change or update, then you can already inform about that and say that you will maybe issue a project soon about this topic. So the objective here is to show to your management that you have everything in place to identify any potential issue related to your products or your process or your system, etc. So now that you have reviewed, analyzed that, get all the information, so the output of the management review is mainly if there is any improvements that are needed for your quality management system to maintain the sustainability, the adequacy, the effectiveness of it. So mainly this is the answer that you have to provide. So is there any improvement needed? You can say no, there is no, after reviewing everything, no, there is no additional improvement needed. For that, our system is working well. You can even decide to change, for example, your quality policy, your quality objectives, some elements. You can say, oh, I will improve my quality policy because of that, or I will change my objective because now it's over and I will add a new objective. So you can also make those kind of evaluation here. You can also make some improvement of products, as we said. If you find that there is too much complaint about something, feedback that is interesting that maybe will trigger a change of products, you can say, okay, let's have a new project to improve this product. So an upgrade of our products for this and for that. And you can also decide that during this management review. As we said also, if there is any changes related to the regulatory requirements, if you need to change something, then you can also decide that here and say, oh, I will change this and change that. And the last one is resources needed. So we have some time when we are making this management review. We identify that we have some issues because somebody left the company and we haven't had the time to replace it. And here the idea also of resource need is that, is there any lack of resources? What are you doing to maybe replace these resources? You have to disclose that here, because having a justification like we don't have enough resources, it's why we have issues, is not acceptable by any authority. But saying we have somebody left, but we are in process of replacement. In the meantime, we have trained another person to take the lead, etc. It created a small disturbance, but then we are able now to correct that. Then this is a reassuring message saying, yes, we know there was an issue, and it's not a problem to mention there is an issue. The problem is that if there is no actions to solve or to talk about this issue. So this is mainly what you have to mention here. This is what I've told you here now is the minimum requirement. What does it mean? It means that you have at minimum show all those information that I talked to you during the management review. But I was part of big companies and we added some additional topics to it. So the objective is not to say, I will talk only about that and nothing else. No, it's here is the minimum. But if I want to add something else, if I want to add, for example, new project development section, this can be something that can be placed there. If you have a specific thing like related to supplier management, if you want to add a section specifically about supplier management, you can also have that here. You can add whatever you want, but at the minimum, you have to have the elements that we talked about, the inputs that we talked about here, because this is mainly what is mentioned on the ISO 13485. So as soon as you have completed all that, normally, as I've said, you have the agenda that people receive, the presentation in PowerPoint, you have the report that is showing what you talked about and the actions that you plan maybe out of it, then the attendance list that is signed by everybody. And this is what a notified body or an FDA, for example, will check. The only thing is that, for example, the FDA, you can hide for them all the content of the management review. You can hide the information that are kind of confidential inside, but you have to show them that there was a management review, like the agenda maybe, or the attendance list, or something that is not showing confidential information. You have to show them. All the rest, you can black that out. I mean, we have done that within company, so we black it out and we show, yeah, here are the files. So they look at the slides with all blacked out because they don't have, it's not mandatory for them to see that. But for a notified body in Europe, it's mandatory for them to see that. Normally, there is no consequences for them to show that, because the objective is just to show that the process is working, that there is issues, and if they have issues, it's not a problem. The problem is not to have issues. The problem is that what are you doing with those issues? And you have to show the management review, and this can be a big help for you, because usually the management review is something that the notified bodies are looking at the beginning. They arrive and they say, oh, let's show me the presentation, and can we look at the management review now? And you show them the management review, and they already, by looking at it, they already have a good idea of the company, how it is working, the level of details that you are going through. And it's not like, it's something that can really help you if you are showing something that is really good for the auditor. So don't hesitate to provide information, even if there is some issues, to show that you have solved the issues. You are normally in control of what you are showing to the notified body. So this is something that should be really helpful for you. But this is a key document for you, a key elements to show that you are really doing some kind of good evaluation of your quality management system. Because this is normally the meeting where you say my quality management system is good or my quality management system is bad. So I hope it will be good for you. But I am doing that with a lot of manufacturers, helping them to set up that, but also making the first ones with them. So the idea, as I've said, is that you have to have a good procedure. You have to train your people on it. You have to have forms or templates that are already available. Then you have just to execute, and only that. It's really something that can be done easily. It can be maybe starting slow and increasing month after month or quarter after quarter. What I am advising, if you are a small company, do it twice a year. So because the idea is to show that you are not just waiting end of the year to evaluate maybe something that happened in January or February. So you are really gathering that, and maybe mid-year you are making a review on this and that. If you are a big company, if you are a company, a corporate company, once a quarter is really a good periodicity, because you have a lot of products, you have a lot of information, a lot of data that are gathered. So having an evaluation every quarter will make you reactive if there is some signals that something bad happened. If you are waiting half a year or full year for something that happened in January, then you can have a big issue, and you can also have some issues just to justify that to the notified body. So it's why it's maybe better for you to make it once a quarter. Okay. I think I covered everything about management review. If you have more questions, don't hesitate. Send me a message, put a comments on the video, or contact me on LinkedIn. So you can get all my details also on the show notes. But yeah, don't hesitate really to ask me a question about that, because it's really an important process. There are two processes that you have really to have before to get your certification ISO 13485, which is the internal audit, and we have made a video about that a few months ago or 1 year ago. And you have this management review, which is something that is also key for you. So don't miss that. Don't make it too easy, if I can say, for them to catch a non-conformance, because these are really the minimum that you have really to have. And I think we discussed also that during a video or podcast with Martin Witte from TÜV Süd, where we said that internal audit and management reviews are really the key processes that you have to have. So I hope this will be really helping you, and with that you can pass all the audits. But as said, if you have any questions, don't hesitate to contact me. And if you have any projects, if you need really some support for your quality or regulatory affairs, or for authorized representative, or for importer for the European Union, for Switzerland, don't hesitate to contact me at info@easymedicaldevice.com, info@easymedicaldevice.com. And I'm sure we can help you, if I can say, on your organization. Okay, so I wish you really a nice day, and I see you soon.